Hi, I'm Dr. Cooley, and in this webinar, I'm going to be talking about why are people always in pain, or why do they have an injury that they can't get over? And what I want you to understand, some of the goals I want you to get out of this webinar is you want to understand what are the mechanisms behind pain, and also what are the mechanisms behind being inflamed all the time, okay? You want to learn what these drivers are of inflammation and pain, and I'm going to give you some practical tools to try to help you reduce this pain and inflammation in your body, okay? So in order to really try to understand why we're in pain all the time, you need to realize what actually is pain. Like what is going on in our bodies when we feel pain, okay? So pain is actually in our brain, all right? Maybe you don't want to like discount for someone that's in pain all the time to say it's all in your head, but in some ways it actually kind of is. It's the way that your brain is constantly taking in the sensory environments. Your brain is always taking in information, whether or not it's me standing in here or what I hear in the back of my head or what I'm seeing in front of me. All this information is getting sent into my brain. If my brain takes all these signals from my body and it interprets these signals as being either a threat or it actually perceives it as being actual tissue damage to my body, I will get this perception of pain, okay? For as unpleasant it is to be in pain all the time, there's actually a reason why we feel it, okay? Because if we didn't actually feel pain, we wouldn't try to heal and recover, all right? So if we had a major injury in our leg, we actually do need to rest it in order for it to get better, okay? So for as much as we all hate to be in pain, there's a reason why it's there. You need to kind of look at it in that context too. So that's one of the big problems with taking pain medications all the time is you actually want to know when something is wrong in your body. You don't want to constantly be dampening this signal that your body is trying to tell you, all right? When it comes to pain, like I said before, all these different receptors will influence how our body perceives pain. There's all these different sensory signals getting sent through our body and how we receive pain. But the biggest sensory signal to our brain that will has an effect on how we perceive pain is this thing called nociception. Nociception, it's a nerve signal that gets sent to our brain that will more than likely, or can very well likely be turned into a pain perception, all right? So nociception is like if I hit my finger with a hammer, I'm basically gonna send this nociceptive signal up my nerves, into my spinal cord and into my brain. And what nociceptors basically do is they sense tissue damaging stimuli. If I held my hand over a hot stove, that's going to stimulate nociceptors, chemical nociceptors, and that's going to get sent up into my brain. Now, we actually have nociception getting sent to our brain all the time, and we don't actually feel pain all the time. So our brain, in some ways, it's actually modulating how much nociception actually gets to our brain. Or if your brain is perceiving this nociception not as a big deal, or it doesn't really perceive it as a threat, it's not really going to cause these things that make it perceived as pain. So when it comes to setting off a nociceptor, like if I hit my finger with a hammer, I'm going to send this nociceptive signal to my brain. In order for that trigger to get pulled, there's actually a chemical that pulls the trigger, okay? So these different chemicals aren't really important to you. You don't necessarily need to know the names of these chemicals, but you just need to understand that for all these different chemical signals that can turn into nociception, we're constantly trying to develop medications or we can do nutritional things to dampen how often these nociceptors get triggered to our brain, okay? So inflammation is actually a different process than pain, even though a lot of times they get used synonymously with each other. So inflammation is really the biological response to tissue and injury. And the best way to think of what inflammation really is, if I cut my finger, the process that occurs in order for me to heal that cut is really inflammation. So that being said, you really need to look at inflammation as really the healing process. It's not actually a bad thing, and without it we would all be in really big trouble. We'd all be dead. But where it goes wrong on most people is most people are stuck in this chronic state of inflammation. So their body's in this constant state of trying to heal things or trying to fix all these different tissue injuries, and it never really shuts off this mechanism, and that creates a lot of pain. So another reason why pain and inflammation get so used synonymously with each other is those same chemicals that are used to trigger nociception in our body are the same chemicals that are used to create this inflammatory response in our body. So again, we want to avoid this state of chronic inflammation. So in general, we want to dampen these chemicals that are going to perpetuate this inflammatory response, okay? So when it comes to what actually causes chronic inflammation, there's a couple different factors, and we're going to touch on all these here. But the first big one is always diet. I mean, diet is the foundation for everything when it comes to healing. The next thing we're going to talk about is something I call dysbiosis, and then we're going to touch on some of these other issues. This graphic, what I want you to understand is how somebody can get trapped in this vicious cycle of pain and inflammation. Let's just take the example of I sprained my ankle, okay? So, or I sprained my wrist, something like that, all right? So if I sprain my wrist, what's going to happen is I'm going to get this release of chemicals. What these release of chemicals is going to do, one is it's going to stimulate this nociception. So the nociception, that's going to come up to my brain, and that's going to tell me, yeah, there's something wrong here. At the same time, it's also going to create this inflammatory response so my body can start healing this injury, okay? When I get that signal of nociception sent up to my spinal cord and into my brain, it actually is going to start to create altered muscular control over this joint, okay? So the way my muscles in my elbow and wrist start to behave, and actually throughout my whole body from just spraining my wrist, are going to be different, okay? So one of the problems though is we start to get this muscle imbalance. That starts to create abnormal joint function, and now that sets us up for another injury. And now we end up re-injuring the same area. We get the same release of chemical mediators, and this process goes on and on. One of the problems is if we eat a pro-inflammatory diet, the amount of chemicals, mediators that get released, and the amount of inflammation and the amount of nociception that gets sent to our brain is going to be more significant than if we ate a anti-inflammatory diet. And another thing to understand is, like, what are we trying to do with a treatment? What is a chiropractor? What is a physical therapist? What is anybody, even a physiatrist or a pain management person, what are they trying to do? We're always trying to break a cycle that someone's getting trapped in, okay? So ultimately, say you go see somebody and they put you on anti-inflammatories. They'll put you on anti-inflammatories that can help break this vicious cycle of pain and inflammation. But if you go see a chiropractor, go see a physical therapist, they might be able to change that neuromuscular control. Or they might be able to inhibit nociception that's getting sent to your brain. So these are all different ways that people are trying to break this cycle. And a lot of times you really need a combination of everything. You really need to eat this anti-inflammatory diet. You need to do some things that are going to stimulate the altered neuromuscular control, or restore the neuromuscular control back to normal. So what is an anti-inflammatory diet? So I have a video based on what I consider the fundamentals of health when we talk about diet and nutrition. So even if you just stuck to that diet, it's going to be in general an anti-inflammatory diet. But like 3 diets I would in general recommend would be like a paleo type diet, a Mediterranean diet, or a Weston A. Price type diet. And these are all going to be whole food based diets, meaning most of the things that you're eating on these diets are going to be things where no one has to tell you what the ingredients are. You just know. There's not a lot of packaged, refined products on these diets. If you shop from the outer aisles of the grocery store, you're going to be going a long way towards trying to eat an anti-inflammatory diet. So that means you're eating more fresh fruits, fresh vegetables. You're going to be eating meats, eggs, those types of foods. Well, one of the big things for getting that inflammation down in your body is trying to lower this ratio of omega-6 to omega-3s in your system. And I'm going to be talking a little bit more about that when I talk about fatty acid imbalance. And one other thing that I actually consider a healthy food to eat to get inflammation under control, and that is saturated fat from grass-fed animals. So this is going to be like grass-fed beef, grass-fed butter. These are big things that I'm always pushing in the office as a way to calm down inflammation. This next topic that I'm going to discuss is dysbiosis, or subclinical infection, or sometimes we'll call it stealth infection. But it is the most overlooked cause of chronic inflammation. Like if someone has an autoimmune disorder, whether it's rheumatoid arthritis or whether it's Crohn's disease or any type of long-standing immune dysfunction, there's been research that has shown that oftentimes these dysfunctions are getting driven from some sort of a bug. What I mean is like a virus, a bacteria, a fungus, a parasite. These are things that our body is dealing with all the time. Like a lot of times we're sick, but we don't really know it. We have this imbalance of like good bacteria and bad bacteria in our gut, and that sets us up for inflammation. Or we're constantly dealing with like some Epstein-Barr virus that goes into remission, but we never really get rid of it. The problem with these microbes or dysbiosis in our system is it sets us up for other issues. So it creates this constant attack on the immune system, which may cause us to eventually develop something called like leaky gut. Like if we don't have this good balance of good bacteria and bad bacteria in our gut, that can set us up for this thing called leaky gut, which can set us up for developing a lot of food allergies. Other things that it'll do is it will deplete all our antioxidants. And we're going to talk about that a little bit later. And it can also create a lot of toxicity in our system. So a lot of these bacteria, they create toxins in their body. It's just the defense mechanism that they utilize. And we can't clear this bacteria out of our body, or we're going to have this constant toxic overload to our liver. So there's so many things that can come off of a dysbiosis. The problem is it can be difficult to identify and difficult to know what you should actually treat. Like it's easy to see that somebody is inflamed, but it can be hard to know what you actually have to do to fix it. As far as like fixing a dysbiosis, in general, you want to recommend like a low carbohydrate diet, especially for something like a fungus. You definitely need to get rid of like all sweets, no artificial sweeteners, things like that, because those can actually just feed a fungal issue. A lot of bacteria, a lot of the bad bacteria in our gut, they're going to feed on eating things like sweets and refined carbohydrates, things like that. You need to be, if you're someone that seems to have a lot of digestive issues, sometimes you just need to be aware of where your food is coming from, because it's easy to get a bacterial ingested in your body. So if you're going out to eat all the time, that's going to put you at more risk than if you're eating at home as far as exposure to some microbe. Sometimes you need to have filtered water, filtered air. Filtered water versus osmosis type water systems are going to be good to utilize. You need to be aware if you're getting exposed to mold. This can be a huge reason why people have autoimmune and inflammatory conditions. If they have, they're constantly getting exposed to mold, or they had a history of being exposed to mold. You gotta be careful when it comes to using antibiotics. You overuse antibiotics and can set you up for a fungal issue. You can overuse antibiotics and clear out all that good bacteria in your gut, and that's really a good protective mechanism that prevents you from getting these infections later on. Oftentimes when patients come in, they do need some form of herbal support to help really clear dysbiosis from your system. It's not to say that you can't clear it on diet alone, but it is tough. A lot of times you do need some support in order to do that. A lot of times when it comes to inflammation, people think of like, oh, I should just take something like ibuprofen. I can just take Advil. I can just take aspirin, something like that in order to deal with it. Unfortunately, nobody in the history of mankind has ever really had a headache from an ibuprofen deficiency. That's not like a real thing. It doesn't mean that ibuprofen can't help that condition, but we weren't designed to have ibuprofen deficiencies. We're designed where we could have a deficiency in essential fats. We're designed where we could have a deficiency in fish oil, things like that. But we've never been designed to have an ibuprofen deficiency. That's not something that our body needs. Okay, so if our body responds well to taking a non-steroidal anti-inflammatory, so this is anything it could be naproxen, so that's like Aleve, or it could be ibuprofen, or it could be aspirin. What that means is there is a imbalance of the fatty acids in our body, and that is a dietary issue. Okay, so our fatty acids, these produce hormone-like substances. And what these hormone-like substances do is one of the jobs that they do is they will regulate immune activity. So they like to they can act as like a rheostat for immune activity. If we need our body's fighting an infection, our fatty acids can actually help turn up the activity to increase that response. Or say our body is getting really inflamed, these fatty acids can actually calm that inflammation down, okay? And our fatty acid makeup of our body is actually driven from our diet. So when it comes to these fatty acids that we're talking about here, there's a lot of different types of fatty acids, but the ones that we're going to be discussing with regards to inflammation and ibuprofen are these omega-6 and omega-3 fats. So if you're looking at this chart in front of you, we start off looking at omega-6 fats. These are things like vegetable oil, corn oil, safflower oil, soybean oil, things like that. Those fats will get converted. They can get converted into anti-inflammatory hormones or anti-inflammatory prostaglandins. And if you're looking at that far right side, those are things like flaxseed, walnuts. These are omega-3s. So a lot of people have heard of the healthy benefits of omega-3s. So the biggest reason why omega-3 is going to be beneficial, like fish oil, something like that, is how it can help calm down inflammation in the body, or how it can help restore a fatty acid imbalance. And if you look at this middle column, these are omega-6 fats that are precursors to this substance called arachidonic acid. So this can be found in like meat, dairy, things like that. And this arachidonic acid can actually turn into these inflammatory-like components. And if you're looking at this chart, the big thing I want you to grasp is how if we have too much omega-6 fats, that's on the far left side of the column, even though those can become anti-inflammatory, for most people, those actually get turned into pro-inflammatory chemicals, okay? So we have that left-sided column, and now we end up driving these omega-6 sources into inflammatory hormones. All right, so if we're looking at this chart still, what does an NSAID do in regards to this chart? What a NSAID medication does is it blocks the production of those hormone-like substances. So it blocks this production of PG1, PG2, and PG3. So if our fatty acids were balanced, an ibuprofen or an NSAID wouldn't really have any effect on us. But if we're getting driven too much into that pro-inflammatory PG2 substances, then we are going to see a benefit from taking something like ibuprofen and aspirin, okay? Unfortunately, the confusing thing about this chart is you would look at it and you would assume that, all right, I just need to not eat red meat, or I need to not eat dairy. And if you've ever heard anything that I've said before, you would realize that I'm actually a big proponent of eating those foods. So why would that be? The biggest thing that creates an imbalance in our fatty acids is actually too much intake of those omega-6 fats. So like eating too much of those vegetable oils, eating too much of that soybean oil is really the biggest thing that creates this fatty acid imbalance in our system, because those oils will actually get driven into producing too much of these pro-inflammatory prostaglandin 2 type hormones. So when it comes to what do I do to make sure my fatty acids are balanced? Well, with anything, large consumption of fresh fruit and vegetables is always key, and consuming a lot of cold water fish is actually something that can be beneficial. You don't want to do a ton of cold water fish because of other reasons, but if you can try to get that in at least once or twice a week, that's going to be good. A complete avoidance of trans fats. So if you're looking at that chart again, trans fats will they disrupt the production of these good anti-inflammatory PG1 and PG3 type hormones. And trans fats are going to be anything that's like a hydrogenated oil, things that are found in like margarine and shortening, a lot of packaged baked goods, things like that. And those can create a lot of inflammation in somebody. you want to get your insulin levels down. Because if you can get your insulin levels down, your body won't be driven to produce those inflammatory PG2 type hormones. And you definitely want to get that vegetable oils down. A lot of times I'll recommend a fish oil supplement for patients. That's an omega-3 supplement. But the one caveat with that is a lot of people take fish oil, but they actually don't have enough antioxidants to go along with it. And that fish oil can be detrimental if you don't have enough antioxidants like vitamin A or vitamin C or vitamin E to go along with it. So you can definitely overdo it when it comes to fish oil supplements. It is best to work with somebody to realize that you're taking the right amount of that supplement. Let's discuss what is free radicals. Okay, so a lot of people don't really understand that term. They might have heard it in contexts, or they've heard of the term antioxidants. Almost any like superfood, they try to promote it as like, oh, it's a great antioxidants. All right, so a free radical is a chemical that our body may produce, or they're like chemical bullets, okay? So the easiest way to think of that is if we have a bacteria in our system, our immune system is actually going to create these chemical bullets called free radicals in order to kill this bacteria or kill this virus, okay? And what protects our own body from these chemical bullets are these things called antioxidants. And the antioxidant system are basically our bulletproof vest from these free radicals. And antioxidants can be a lot of different things. Ultimately, it comes down to how well our body can utilize this chemical called glutathione. This is like our master antioxidant in the body. And this is reliant on good protein sources, having good sources of cruciferous vegetables. These are things like Brussels sprouts and broccoli, cauliflower. Those are good sources of getting these precursors to make glutathione. We also need to have the mineral selenium in order to activate the glutathione in our system, and we also need to have plenty of niacinamide in our body to be able to process glutathione correctly. But when it comes to this protecting ourselves from free radical, or what free radical pathology really is, this can become really apparent when someone gets sick and they have this cold that they just can't kick, okay? So say you get a sore throat or you get a cold and a month later you're still sick. A lot of times what's actually going on is not that there's an active infection at the time. It actually means a lot of times what's happened is your body came in there, your immune system came in, it did what it was supposed to do and actually fought the infection. But at the same time, it created some collateral damage because you didn't have enough antioxidants in place to protect yourself from this immune activity that was required to fight the infection. And now what's happened is you get this collateral damage that happened, and now the immune system reacts to that. And because you still don't have enough antioxidants in your system, you create this vicious cycle where immune activity just keeps self-perpetuating itself. So there's a lot of times where someone could have a sore throat that lasts like a month, and they actually go to culture that sore throat and they would find no active infection at the time. And in most cases, that's going to be due to some antioxidant depletion. And antioxidant depletion is going to come from a lot of different sources. A big thing is just overtraining. So training too hard is going to do it. Too much stress in our life that keeps causing us to pump out cortisol. Too much exposure to toxins because we need glutathione to process heavy metals and other toxins in our system. So if we're getting too much toxic exposure, we're going to become glutathione depleted and we'll become antioxidant depleted at the same time. So how does stress impact our immune activity, or how does stress impact our inflammation? Well, so excessive stress can be caused from a number of factors, whether or not we train too hard, whether or not we eat a diet that's focused too much on caffeine and refined carbohydrates, whether we're working too much, whether or not we don't have enough sleep. All these things, if we have too much mental, emotional stress at home or at work, all these things can create this bombardment on our system and really stress our adrenal glands to try to respond to this stress. So when our adrenal glands are stressed, one thing that can happen is we're going to start to get these imbalances of cortisol. And cortisol is going to have a huge impact on our immune system. So if our cortisol levels are high, meaning someone's stressing us out, or say we just took a bunch of caffeine, or we're eating too much sugar, it could create a scenario where our cortisol levels get really high. When that happens, when our cortisol levels are higher, actually our immune activity is going to be decreased. But the problem with that is that actually sets us up for things like infections. And infections are a huge cause of why someone has inflammatory issues or why someone has immune dysfunction. At the same time, if our cortisol levels get too low, if we've been dealing with a long-term stressor for too long, our cortisol levels will eventually get too low. And now that's going to set us up for things where we have this hyper-vigilant immune system, and we'll become susceptible to things like allergies and just a lot of chronic inflammation. So the best way to think of, like, when someone has an autoimmune type condition, that means their immune system's starting to attack their body. The first thing that they're going to get more than likely is going to be a prescription for prednisone. And prednisone is basically just prescription cortisol. It's actually a lot stronger. So the only problem with that is it doesn't really do much to address why did the immune system get out of whack in the first place. You need to look at, well, like, maybe my immune system is off because I have this low-grade fungal issue going on, and if I take this cortisol or take this prednisone, it's actually going to make this situation worse. It's not to say that prednisone can't help patients. It helps people all the time. It can definitely be like a miracle drug in some cases, but it does little to really tell you what caused you to get in this problem in the first place. So key supplements for reducing inflammation in general. You're always going to hear me bring up grass-fed butter when it comes to anything that I'm doing, just because it's the number one thing that I can use to tell people that you need to start incorporating this in your diet to get your inflammatory system calmed down and actually help stabilize your blood sugar too. Fish oil can be a huge thing. Those fat-soluble vitamins, everyone talks about vitamin D. Vitamin A is almost equally important. It's not to discount how important vitamin D is for all of us. A lot of things like magnesium and zinc can be really key. But the other thing too is you need to work with somebody to help find the specific anti-inflammatories that are going to work best for you, because sometimes it can be very difficult. As you can see, this is a really extensive list of how many things that can be used to calm down someone's inflammation. And what one individual needs is going to be a lot different than what someone else needs. And it can be very difficult to understand what is going to be best for you. If you got any questions on how I try to address immune activity or how I try to deal with chronic pain and inflammation, feel free to contact my office and I'll be happy to talk with you. Thank you very much for your time, and I look forward to hearing from you.